This is Sadie Martinez. I'm the Access and Functional Needs Coordinator here at the State of Colorado Office of Emergency Management. I describe myself as a middle-aged Latino with long black hair, and then I do have these little things they call, I call them wisdom highlights, others call them gray or silver. I have dark eyes and olive skin. My pronouns I use are she, hers, and hers. The program I coordinate here at in Colorado focuses on what Vance was talking about, the outreach, partnership, and engagement, the trifecta of inclusive planning. What that means is we do a planning with approach using an access and functional needs framework. This framework suggests that there are resources everybody needs during emergencies, regardless of who we are. This means that everyone needs access to resources in order to function during emergencies. Not only do we need those resources, they need to be equitable. We need to have equitable access and accessible access, regardless of who we are in the community. We do that by using a CMIST, C-M-I-S-T, memory tool for the purposes of emergency planning, preparedness, response, and recovery. CMIST, C-M-I-S-T, those resources are utilized to help people remember and include the 5 functional resource needs individuals may have in an emergency and disaster. It also provides a shared language across all of us, any culture, any disability, any subject matter expertise. The C stands for communication resources. The M stands for maintaining health and medical resources. I stands for independence resources. S stands for support services and safety resources. T stands for transportation or mobility resources. This memory tool was developed and shared from June Kales and Alexandra Enders. Thank you, June and Alexandra, for giving us some shared language that is easy and plain language for all of us to be able to understand, no matter what we do, where we live, or how we serve our communities. So I have the honor today, and we are gathered today for holy matrimony, totally kidding. We are here today to be able to learn from each of our panelists. These are my vows, is what I'm trying to help you all also commit to today. We want to learn from our panelists. We want to share experience from our identified shortfalls, gaps, and problems with the solution focus and some how-to approaches for whole community inclusion before, during, and after disasters and emergencies. We hope you will learn something you don't know because either you don't have the lived experience or have met with those who serve the community members with lived experiences, or you still just have a wonderful opportunity for growth. We hope some of these stories shared today and tomorrow will help you in your path of starting, stopping, continuing, and changing in the work you are doing for your whole community inclusion in emergency management. We encourage you to find things from the panels as well as the symposium that you have learned, and then how you will apply it, and then as well as how you will share it. I call that the force multiplication, and actually I don't call it that. I learned those from the wise words of our FEMA Regional Disability Integration Specialist, Mike Houston. So we call that the force multiplication. And with that, it is my honor to serve as the panelist for this great panel, Outreach, Partnership, and Engagement, the trifecta of inclusive planning. Please help me welcome our panelists. Iskra Kilgore, the Assistant Commissioner of Community Engagement, Bureau of New York City Emergency Management. The Bureau aims to strengthen the local social infrastructure by taking a whole community approach to preparedness, response, and recovery. She is responsible for the leading and strategic planning and outreach efforts focused on community preparedness, individual emergency preparedness, and education. She also leads the planning for provision of language access services during emergencies in New York City and serves as New York City's Emergency Management Language Access Coordinator. We have also Dawn Brantley, the Acting Director of Massachusetts Emergency Management Agency, and has been in emergency management for over 14 years. And as a local emergency manager, a regional and state emergency management, and with FEMA's Office of Disability Integration and Coordination. Director Brantley has dedicated her career to inclusive emergency management as an attorney, a certified emergency manager, a certified ADA coordinator, and a co-chair of the National Emergency Management Association, also known as MEMA, M-E-M-A, Diversity and Equity Committee. When she's not working with MEMA things, she's serving as co-founder and vice president of the International Association of Mass Care Professionals and operating the free online community, Inclusive EM Community. We also have Yumi Sera. She is the strategic advisor for the state of California's Vaccinate All 58 campaign, where she has initiated innovative programming, including a partnership with Disability Rights Education and Defense Fund, or DRDF, to develop communication for youth with disability. She also serves as the deputy director of the State Outreach for California Census Office, worked with Disability Rights Fund, and currently serves as the advisor to Ohana, a grassroots women's with disabilities organization in Indonesia. And finally, we have Bryan Russell, the Emergency Management Coordinator with Disability Rights Florida, where he works to ensure the needs of persons with disabilities and their caregivers are included in emergency preparedness, response, and recovery efforts across the state. Prior to this role, Bryan was the program manager for the Florida Department of Health as in the Disability and Health Program, where he focused on adapting and implementing public health interventions for people with disabilities. During emergencies and disasters, Bryan serves as the Access and Functional Needs Coordinator with the Florida State Emergency Response Team, providing guidance and recommendations to ensure the needs of people with access and functional needs are met during all phases of disasters. I will ask and allow each panelist to answer with their subject matter expertise experience with recommendations, solutions, and stories in mind. I will ask each panelist to only turn on their cameras when they are speaking and turn them off when they're not, so we can ensure that equal access to the ASL or American Sign Language interpreters. And with that, I am going to kick this off and starting with the question, and I'm going to ask Dawn to go ahead and turn on her camera. And I'm going to start this with asking you, Dawn, why are partnerships so critical sorry, let me start all over. Why are partnerships so critical to improvement of accessibility, equal access, and inclusion of state and local emergency management programs?
Thanks, Sadie. It's an honor to be here. Thank you guys for including me in this fantastic panel. You know, emergency managers are usually not experts in disabilities, medical needs, access and functional needs, and nor should we be necessarily. And every other topic area of emergency management, whether public utilities, air ops, transportation, communications, we are the facilitators and the coordinators who rely upon the subject matter experts to inform us of what needs to be done and how to do it. Access and functional needs is or should be really no different. AFN SMEs, those subject matter experts, as planning, response, and recovery partners are that bridge from knowing that we need to ensure our services, our plans, and our programs are accessible to actually making them accessible. That's all, Sadie.
Thank you, Dawn. Well, then I'm going to pass this on to Yumi. Yumi, can you share that answer of why partnerships are so critical to improvement of accessibility, equal access, and inclusion of state and local emergency management programs?
Good morning. Good morning, everyone. It's great to see you today. My name is Yumi Sera, and I'm with the state of California. I'm happy to join Vance Taylor in this great state. And I'm going to be here to be sharing my experience with the COVID-19 vaccination campaign, a different kind of emergency and disaster for sure. and also to share with you a bit about how this is building on our California Census campaign. I'm really honored to be here and excited to be here to hear already. I've already learned from all of these panelists just in the prep session. And I'm coming to you today to really talk about the inclusive and equitable outreach and communications. And so partnerships for me, maybe where I could start is I'd like to start with what we did with some of the partnerships that we developed with our community partners. And in the beginning, when I started at the California Census campaign, brand new to the state, worked with our stakeholders, and as a team of our office, we created what was called a language and communication access plan. And it was only because we had the input of our stakeholders who then became our partners, which ensured that language and communication access is both linguistically, culturally appropriate, and provide equal access to California's population. And I think this is where we also included partners like Disability Rights California, who joined us and really educating the state about what communication means in terms of communication access. And it's not just about language, but it's also about being culturally appropriate. This plan was a foundation of my own journey here at the state to be inclusive people with disabilities in the language and images we use, in the tactics we employ, and most importantly, as I think we all know, how we continue to learn, make a lot of mistakes, get beaten up, learn again, get up, and just really, it's really what I call a learning journey. So I'm happy to be here again, and then to switch over to the next panelist so we can get everybody's voice in here.
This is Sadie. Yumi, thank you. And you know what? I think I changed my mind so that we could gauge, especially because I'm a very visual person. Can I ask each of the panelists to go ahead and turn on their cameras? And for those who will benefit from using the ASL interpreter or need the ASL interpreter, I encourage you to go ahead and pin the ASL interpreter. All right, I'm going to pass this over to Bryan. Bryan, your experience with why partnerships are so critical to improvement of accessibility, equal access, and inclusion of state and local emergency management programs.
Hi, Sadie, and hi, everybody. Thank you so much. Being on the East Coast, I have to say good afternoon and good morning to everyone. So to get everybody covered there. So here in Florida, partnerships have been vital, especially through our myriad of disasters recently. So really mainly here in Florida, one thing that we really did was we embedded our Florida Centers for Independent Living in our State Emergency Operations Center. This also allowed and encouraged our local Centers for Independent Living to do the same with their local EOCs. What this did was this enables us at the state level to develop inclusive plans and be able to quickly respond in real time during a disaster. It helps us really kind of reach out and respond to any access and functional needs or disability needs during a disaster. Our next challenge in developing these partnerships at the state and local level are to link our local ADA coordinators with their county emergency managers. This is a conversation that we've had over the last probably 3 or 4 months on how we can get different ADA coordinators into this emergency planning and response role.
This is Sadie. Thank you, Bryan. All right, now over to you, Iskra.
Hi, everybody. Thank you so much. My name is Iskra Kilgore from New York City Emergency Management. I would say that for us, partnerships have been critical because, to Dawn's point, emergency managers are not necessarily experts on access and functional needs, and adding that voice to whatever work we are doing is critical. We also do a lot of community-based planning where we engage community and faith-based organizations to do their own community plans. And we encourage these groups and coalitions to involve organizations that work specifically with people with disabilities, access and functional needs, to incorporate them in this community planning, because as Vance opened up in the beginning, the community, the people with disabilities are disproportionately affected during emergencies or any types of access and functional needs, really. And so we, on the government level, do a lot of planning, but we also encourage the community to do their own planning, and then we link those two together. So there is a link between them and us when we activate and we are working on an emergency, so that the community voice is heard in our operations.
This is Sadie. Thank you. And I will share that that's actually how I met a lot of you on this panel, is seeing the importance of inclusive emergency management and reaching out, especially during that one cootie virus, you know, COVID, the one that never seems to end. Trying to get resources, trying to learn from my partners over in North Carolina, in Florida, Alaska. Dawn, you and I met at an ADA symposium where we were trying to better understand that plan with approach and not duplicate or repeat historical events that have left people with access and functional needs and disabilities out. So I really appreciate you sharing that. And also with that, I'm going to ask to tag along with what you've shared. What are some of the barriers and challenges to what you're doing? Sorry, Iskra, you go first this round.
Okay, thank you so much. Oh my God, there are many. I am going to say that one of the biggest challenge is that, especially when we are talking about working with community and faith-based organizations, which is what we are trying to do, a lot of these organizations are underfunded and understaffed, and it's very difficult for them to get the resources to do this planning that we're asking them to do, and to really think about emergency preparedness and liaising with us. Our program, we have a program that actually provides funding, but even with that, I think, especially thinking about COVID and how organizations were affected, and how much capacity was lost during the pandemic, I think just the capacity to do this planning is limited. And I would say that's the biggest challenge, one of the biggest challenges we are facing.
Thank you, Iskra. All right, we're going to go to you, Bryan, to answer that. What are your big barriers and challenges to what you're doing?
Some of it comes from a lot of the barriers and challenges would be kind of the phrases from the phrases that we tend to hear a lot are, we've never done it that way before, or that's going to cost too much money. One thing that we've heard lately is, well, our shelter is in a school, is run by the school, or the school district runs the shelter, and we can't, and if we open classrooms up to the autistic, to autistic families, that's just going to be too much for them to clean up. So doing things differently is definitely a big one. Yeah, I mean, that's kind of the main one, really, is just we've never done it that way before. It's going to cost too much money. Yeah, those are the main ones. Maybe another one would be something, that
Not my job.
Yeah, not my, thank you. I couldn't think of the word, but yeah, not my job. I actually had one person tell me that everybody with a disability needs to go to our special needs shelters. They need to have their own separate shelter. I did all I could to stay professional. After the meeting, I was able to rant and do what I needed to do. But yeah, so some of it is also just a lack of understanding of disability, of access and functional needs and disability competency.
This is Sadie. I love that example. I use that as we don't know what we don't know. And the reason why we don't know is because we haven't asked or seek to understand. My counterpart here at the Colorado Department of Public Health and Environment Office of Emergency Preparedness, Amy Siebert, when we first came together, I said, you know, what I'm seeing in emergency management is that there's these finger pointings. People are saying, hey, you didn't because I didn't know. And then they're not able to connect because there's too many finger pointing. However, when we start seeking to understand, to better learn what we don't know because we don't know, we bridge that gap. We come together and it's a bridge. And now we're able to not let anybody fall through the cracks there. And we're able to seek to understand and better understand what resource needs to save as much life and property, and people with disabilities are not left behind, or other community members who come from our access and functional needs community are not left behind as well. So with that, I'm going to ask that same question over to Yumi.
Thank you, Sadie. I love the analogy of the seeking to understand and a bridge. But to turn to barriers and challenges. So I'm really glad also to be on a panel with a bunch of government people as well, because I think one of the challenges that we face as a state agency, as government, is there's in many of our communities, there is a mistrust of government. So when we go out, put our logo on as government or whatever, or we go out to speak, we don't always resonate with our community members. So that's one. The other is that I think this is part of the seeking to understand, is that sometimes the understanding, the learning, and of course the partnerships take time, right? We can't just call somebody, call Bryan and say, hey, I want to partner with you because there's some disaster. We had to have had some kind of a relationship before, and that takes time, right? And the third that we are always struggling with here in California is misinformation and disinformation. How do you combat a lot of the rhetoric that happens on social media, much of which I don't even see because it's not on my social media, but how do we combat that? And how do we do this in terms of partnerships and listening to what our partners are hearing and how they're dealing with misinformation as well. Thank you.
Yumi, I love that. And with that, my counterpart that I called out, Amy Siebert, I'm sorry. She actually came up with those chronic influencers that you're explaining that get in the way. They're chronic influencers that happen on a regular basis that get in the way at the time of disasters and emergencies, which are called teacher, not spelled like a real teacher. And don't say teacher to a teacher because they're like, Sadie, it's not spelled that way. It's spelled T-E-I-C-H-R. And so not the traditional way that a teacher would tell you that it's spelled. And what that is trust. Those are chronic influencers. Economics, isolation, geographically, socially, and culturally, capacity, housing, and then racism. Those all seem to get in the way, and they become those barriers or challenges when we're trying to work, when we're trying to get resources to our community members during a time of emergencies and disasters. With that, Dawn, I'm going to hand it over to you, and I'm going to put teacher into the chat, everyone.
Thanks, Sadie. I think one of the biggest challenges I've seen to building partnerships and seeing more inclusion of individuals with disabilities and others with access and functional needs in both planning and response and recovery is actually emergency managers adding qualification barriers onto disability and AFN partners that we don't put on other subject matter experts. So for example, I've been told that I wasn't allowed to add any other organization to a state other than state disability service agencies to an AFN advisory group, because those non-state disability service agencies don't, I'm sorry, my light's going off because I'm not moving enough. Because those groups that aren't state disability service agencies would need to take a training in emergency management to effectively contribute. But the fact is, we don't actually require any of our other partners to take EM training before participating in a planning group or an advisory group. And we should be treating our AFN partners and disability service organizations exactly the same way. They have very different perspectives than a state level government agency and can provide resources that as a state we can't either. Thanks, Sadie.
Yay, thank you. All right. Iskra, I started with you, right? All of a sudden now it's getting mushy and we're only 2 questions in. All right. So now we identified some of the barriers or challenges. Can you guys, can you all share any lessons learned through all of those experiences? And with that, I'm going to go to Yumi to kick us off.
Sure. Thank you, Sadie. Lots of lessons learned, right? And I think it was actually during the California Census campaign where we started to talk about who we call our trusted messengers. So just as we have misinformation and disinformation and community members don't always trust government, what was one of our sort of solutions to how we dealt with that? We really seek to identify partners who are trusted messengers in our communities. And this means funding community-based organizations and also working with some non-funded organizations. This might be faith-based organizations as well. So these organizations really have the trust of the communities we're trying to reach. They have the understanding of culture and language. And they also have the knowledge of the community's priorities and needs. And they also work together with other partners and stakeholders. And I just wanted to talk about one of my proudest moments, of course, was working with the Disability Rights Education and Defense Fund, and also Brian's counterpart here in California, the California Foundation for Independent Living Centers. And DREDF worked with Rooted in Rights, Yo Disabled and Proud, for vaccination for youth with disabilities. They did a closed caption in English, Tagalog, Vietnamese, and Chinese, and also in ASL and Spanish. And can you imagine how you do that with TikTok videos of youth with disabilities themselves talking about the need to get vaccinated? So as government, because we're not always the trusted messengers, we partnered with our leading disability organizations, had this idea to really, how do we do outreach to youth who need to get vaccinated, who are the young invincibles, right? And so this was one of the ways that we did, we created videos, of course, with Rooted in Rights, who you must all know. But I can, I probably have the access to the chat. I can put those videos in the chat. The other is that partnerships, of course, take time. We don't always have time, especially in a disaster, but what we're trying to build is really a structure and a foundation. So a real infrastructure of these community-based organizations that who we're working with, and really show them the value they bring as a trusted messenger. And as Vance said earlier about working together, we really, especially during these emergencies, we really need to be ready to activate together to reach those who are being left behind. So that's it for me.
Thank you. Thank you for sharing that and those innovative approaches and being able to work with people and meet them where they best understand or receive their communication. TikTok, who'd have thunk that? Sorry, think that. So that's awesome. All right, Dawn, let's go to you next.
Well, thanks, Sadie. I think lessons that I've learned over the years is just the importance of leadership really championing change in these emergency management organizations, doing it by vocally prioritizing accessibility and inclusion over and over again, setting expectations, going to your training or exercise team and saying, here's what I expect of your program as it relates to accessibility and inclusion. Providing training. One of the things that we do at MEMA is if there's a training that the ADA network sends out or that you forward to me, Sadie, or Brian's forwarded some on service animals, I send that out from me to our entire agency with a note that anyone who would like to attend should be allowed to attend and encouraged to attend if their schedule allows. And that just provides that leadership momentum behind it when you have an emergency management director or a state director or regional director being the one who's really pushing. But I think it's important too to realize that we can be champions of change, but we have to create that environment where accessibility and inclusion is standard operating procedure for every person in the entire agency. So it's not just me thinking about accessibility, it's my training team who are looking at the accessibility, not just of their facility, but of their documents, of how they're talking to people. It's my exercise officer thinking, oh, you know what, we're gonna have some role players, and instead of labeling them as someone who has a disability, we're gonna actually put someone with a disability in that role to give us an actual realistic view of how this would play out. So leaders have to be the champions of that change. They create the environment in their agency and set the standards, but the goal is for all of us just to make access the way of life.
Yay, I was clapping in sign language. That very good point there. All right, Iskra.
Yeah, I think I can repeat everything that Yumi and Dawn said to their points. I think those are the biggest lessons learned for us as well. On the point of trusted messengers, obviously we also use our community partners and also our volunteers to be our trusted messengers in communities. One thing that we realize though is that sometimes even on a community level, for community-based organizations, they don't necessarily think about access and functional needs in a way that we may want them to think about access and functional needs, especially if they don't have that expertise. And so we developed a training and resources that we give our community partners on how, for example, how to make their communication accessible. What should they think about when they are distributing information in their communities, or if they're opening any types of vocations to communities post-emergency, which happens often, at least here in New York City, is that vocation accessible? And we gave them a checklist of the things to look at. And also, we try to connect organizations. So if we're working with a community that doesn't necessarily have that expertise, we try to connect them with an organization that has that expertise in the access and functional needs realm to add them to this community and help them with this planning.
This is Sadie. Yes, thank you for sharing that. Other trusted community or messengers are also sometimes community connectors. There's one of our counties that call them cultural brokers. There's lots of different names, or I guess job titles. However, what they serve as is a pulse check. They're able to come back and forth, give emergency management information about what resources are needed, as well as emergency managers sending it to the community connectors. And people then are still included. They're not excluded in there. And so with that, yay, thank you for sharing that. It just reminded me of the different ways that people in different places work with those trusted members of the community. So thank you. All right, Bryan, off to you.
Ditto. Pretty much everything Dawn, Yumi, and Iskra have said. Yeah, so I'm good. No. But no, seriously, I think a couple of other lessons learned that I could think of. One of the big ones is, include the disability community in your blue sky planning. Make sure that people with disabilities are in those meetings. For us in Florida, it would be are in the meetings in January, in April, in May, when you're writing your community emergency management plans. When you're looking to see what items we're going to need to include in the shelters. Things like make sure that that you include them, because you can really prevent potential problems. You can really head off a lot of potential issues by just asking, by including the disability community at the local level and the state level. One of the ways that we learned this was during Hurricane Michael. We didn't think to have sensory kits, have sensory items in shelters. We just assumed that people with autism, that families of kids with autism had their own plan, that they would that they wouldn't go to a shelter because they knew it was not a very sensory friendly area. But we had to address that during the response. We had families who would sleep, who would go to the shelter, but then stay in their cars because the shelters were just not equipped for kids with autism. So that was one of the lessons we learned. And so during Hurricane Dorian the next year, we were able to provide sensory kits to several shelters, Gen Pop shelters, and special needs shelters. So that's one of the lessons learned. Another lesson that we learned was during the initial response of COVID. We had learned through that that people with disabilities were not getting meals. During COVID, one of the big things with the ESF6 with mass care was, at the time up until COVID, we were used to feeding, a small, relatively small area, just the area within the impact zone of a hurricane. But COVID was it was global. So we were having to help feed the entire state. And one lesson that we learned almost immediately was that people with disabilities did not want to leave their house. They felt like they couldn't leave their house because they were immunocompromised. They were at risk of getting this virus. So we had to figure out a way to get food, to get meals delivered to them. Fortunately, we were able to connect. Our state emergency response team and mass care team, we partnered with our local Centers for Independent Living and local food banks. And so where the SILs would go to the local food bank, pick up the meals, and then take it to people with disabilities in their community. So those are just some different lessons that we learned. And it all goes back to inclusion and including people with disabilities and your disability community at the beginning.
Awesome, thank you. Thank you all for sharing those. Yay, and Vance did put into the chat to everyone the video that Yumi was referring to. Also, as we go into our next question, I need to do a quick, real quick time check with you, Vance. Am I still on track?
Yeah, sorry, I sent Sadie a note. Everybody's saying, oh, 1 minute. I was wrong on my clock. You got to.
I have all these timers.
I know, we're just starting to get into it too. This is great, thank you.
Thank you, Beth. I just wanted to make sure. I started sweating there for a second, only because it's hot in here. All right. I love all of those questions that are coming up. One of the things, the next question, really we were on question number 1 and we just kept deeper diving into it. We're going to go into our next question, which are, are there specific response and recovery touch points where partnerships are particularly beneficial? And with that, have any of you had experience with including American Sign Language partners in trusted partnership networks or similar programs, as well as you're answering that? So if you've had also American Sign Language as you had as specific response and recovery touch points where partnerships are particularly beneficial. And with that, we're going to go back again to Bryan. We're going to have you kick off on that one this round.
Oh, thank you. So yeah, so touch points. Some of the response and recovery touch points that really were beneficial. I think for us, it's the touch points at the local level. You know, I think some of those touch points would be, you know, your local centers for independent living, your local, not just centers for independent living, but your local assistive technology organizations, those that can really help make a difference, especially when someone with a disability is leaving the shelter. Things that can help make sure that they are able to maintain their independence. Also during and also utilizing ASL interpreters. A couple of the things that we do is we work with we always make sure to have some really good partnerships with local, whether it's local centers for independent living. I know I keep saying them, but at least in Florida, they're kind of the jack of all trades as it relates to, you know, the AFN community. And so a lot of their staff are able to provide certified ASL interpreters at the shelter and at the local, with local county emergency managers. You know, one of the main things is to ensure that, you know, that at the local level, they use the certified ASL interpreters during press conferences. So yes, local is a really big touch point for us.
This is Sadie. I appreciate you identifying that. We saw that the need, especially during COVID, to be able to reach as many community members, American Sign Language interpreters inside the picture-in-picture went really strong and was able to create even more force multiplication in there. And it was because we had partnerships across in each of our states to be able to start advocating and working together to get that going. So I appreciate you bringing up some of those partnerships. Yay. All right, we're going to ask that of Iskra next.
Yeah, I'm going to say that for emergency management, I think that emergency management is normally just based on partnerships. It's either how we work with the community or how we work among government. So I would say partnerships are very important throughout the emergency management process as a whole. I think specifically for ASL, so every time when there is any type of an emergency and when we put our mayor or our commissioner in front of the public, we have ASL interpreter. For COVID, our previous mayor was running press events, I think every day for close to 2 years. And we went from having the ASL interpreters with him before we knew how contagious COVID it was. Then we had to figure out the technology where they were interpreting from home. We went through so many different challenges to make this happen, but it did happen. And the way we do it in New York City, we actually use a CDI and ASL team where we try to put the CDI in front of the public, because one of the first feedbacks we received years ago when we started doing this is that the community really wanted CDI to interpret for them.
So CDI, sorry to interject, CDI, for those who do not know what that is. Certified Deaf Interpreter.
Yes, so sorry, yes. So that's something we do. And we also, during an emergency response, our plans normally are either to bring interpreters to the field or through video remote interpretation, depending on what the situation is. I have to say, every time we've been in a pinch, the community has helped us a lot. So for example, a few years ago, we needed a sign language interpreter for a very specific Caribbean dialect, and which is not uncommon for New York City, just because there's so many languages that are spoken here. And the only way we could find this person was because of our connections with community organizations. We basically reached out to everybody we knew, and we were able to find an interpreter to help us with that. But that's one example of successful cooperation with the community.
Thank you, Iskra. Okay, let's go to Dawn.
Thanks, Sadie. I'm going to answer this from kind of a broader system level. That touch points is a term shamelessly stolen from public health because it just fits so perfectly. As emergency managers, we should take the time to determine where our response and recovery operations will touch the public, and then focus on building partnerships to ensure accessibility at those touch points. I would include in those areas, and of course, let me attorney this one, include but not limited to mass care, ESF6, including evacuations. It's one of the key touch points, but also ESF8, public health operations, ESF15, public information, also search and rescue, even logistics, and ESF5, which is typically emergency management. So for example, if you're opening a series of shelters and you only have a certain number or no accessible toilets and you bring in portable toilets, then your logistics needs to know to flag that you're going to need accessible toilets, accessible showers, shower trailers that aren't 15 feet off the ground, things like that. So even logistics is a touch point for us for accessibility. For recovery operations, I'd add disaster recovery center accessibility, inclusion of disability service organizations and agencies in those long-term community recovery groups, disaster housing, casework, and multi-agency shelter transition teams. So those are some of the recovery programs I think are big touch point areas where partnerships become very, very critical. I know I'm probably missing some, but these are those critical points to look at so that every place that we are directly touching the public with programs is accessible. As far as ASL, in my experience, we've had ASL interpreters off of a state contract, and we use them for response in our Joint Information Center. But to address those needs during planning and preparedness, we tend to rely on those disability service agencies and organizations that address individuals with hearing disabilities or low hearing. I did see one comment about why aren't ASL interpreters, why is this so hard to do? I can tell you that in the time I've been here with MEMA in 2.5 years, we struggle to find ASL interpreters who will come and spend a day at the SEOC because they feel like they're taking an interpreter away from the community. So we struggle to get them on videos. We struggle to get them at meetings. We struggle to get them in, definitely struggle for, a 12-hour shift at the EOC. We would love to do that, and we're working very hard at filling that gap, but there's, as I understand it, a shortage kind of globally, which makes it harder on our end to be able to provide that, but we have the obligation, and so we continue to work very hard at it.
This is Sadie. Yes, thank you for sharing that. And when it's a limited people resource that helps connect community to emergency management and vice versa, that pinging effect, that also becomes a barrier for effective communication and being able to find different, I call them hacks, different ways to still make it work and still get the communication across. And I learned a lot of those by working with our commission for the deaf, hard of hearing, deafblind, our lived people with lived experience as well. They tend to help us with that. So yeah. All right, I'm gonna send this off to Yumi.
So I'd like to just sort of build on what others have said and add something else. I wanted to talk a bit about how we work with partners, right? And specifically around data. You know, being a part of the California Census Campaign, we're very conscious, and also with the Vaccinate All 58 campaign, we're very data driven of who's who, where are they, what do they do. But with people with disabilities, we don't have data. We know that. And so how, or even people with access and functional needs and people with disabilities, the data is not accurate and it's not timely. So this is a huge problem. And I just wanted to bring this up because this conversation keeps coming up in my conversations as well with our disability community. So one of the ways we've worked with partners, or one of the ways we can as a state work with partners, is looking at partners as those who provide the community knowledge. So locally based organizations such as the Independent Living Centers, who we've also worked with, they combine with neighborhood associations, ethnic groups, churches, whoever, but these really community organizations. So work with them to identify who the people are with access and functional needs in emergency situations or other situations, where they live, who they listen to, and how they could be reached in terms of messaging. So that's really important. The second way we want to continue also to work with partners, since data is not around, or since we don't have a data set, but to create some kind of a data set that could approximate either numbers, locations, needs of people with disabilities, and working with our subject matter experts. Maybe we use available data of what is available. And then, of course, if we're talking about equity, we need to also overlay that data set with for example, Medicaid data. So we're reaching those who are low income as well. And then the third way, and the last way, of course, is to go back to our community partners being the trusted messenger, and that's who we turn to our partners to really seek out the people who so people are not left behind, as we keep saying. And we also turn to our ethnic and local media to deliver the messages, to get vaccinated, to keep our friends and family safe. So those are my points under that point. Thank you.
This is Sadie. Thank you, Yumi. You brought up a great, some great points there. In that, when we are working with our trusted community force multipliers, Centers for Independent Living, also allowing and helping them better understand. I'm going to pause for 1 second. Ron, we're going to ask you to turn off your camera. Thank you. All right, sorry. We want to be able to help our partners understand what exactly are you asking of me. I can't be at the table at everything because that's not really what the service I provide in that community. However, I can provide just in time information, and I need to know how to do that. So as Dawn had brought up, I think it was Dawn, one of you had brought up earlier of bringing people to our exercises so that we could test it. Well, this is another example of being able to test it on the blue sky day. That means there's no problems, right? It's a beautiful day. everything is harmonious. So then the bad day comes, or the gray sky day, the storm comes. We all know what we're going to do with that information. That will help, even if we have the data of our community, of knowing how we're going to work that out. A lot of times this could also help if they're part of the resource gap analysis conversation prior to any event or disaster, being able to help emergency management better understand what gaps are or what resources are needed. And I always go straight to CMIST, the CMISD resources, and start there, because it's a huge elephant of resources. And being able to take one bite at a time out of that, we'll be able to eat that elephant. If we want to eat it all at once, we're not going to be able to. It's impossible, right? So we want to make it possible, and being able to do that with that. And so in Colorado, we actually have my counterpart at Colorado Department of Public Health and Environment, Amy Vos-Siebert. She actually was, along with a lot of stakeholders like our assisted technology partners and Centers for Independent Living, the State Independent Living Council, they all came together and tried to input into a map of Colorado, a lot of that data, Yumi, that you were describing. So it's at least a starting conversation point. It may be delayed, but at least emergency managers know who to invite to come to the table and be able to capture those resource needs of the community and know where they're at as far as where that gap starts happening. So wonderful explanation there. All right, and with that, we are almost down to, we have about 13 minutes left on our panel there. And what I'd like to do is, if each of you will share some really good how-to strategies that you would recommend in order to, as a government agency, on how to work with other agencies or with even your own staff to shift the internal culture to improve their outreach to people with disabilities. And so with that, I'm going to start with Bryan, and then we'll go from there.
Thanks. Sadie, could you repeat that one more time? I was answering somebody's question. Sorry.
This is a multitasker, right? Isn't that the world of where we live in right now? No problem. What we want to do is if you could share some really good how-to strategies that you would recommend, such as, the different ways that how you would work with the agencies. I kind of gave a little bit an example right before opened up this question, and then how you would do it as a government agency, also working with other agencies, and then even in your internal cultural area to improve the outreach to people with disabilities and our other community members with access and functional needs.
Thanks. So one idea that kind of grew out of a discussion from our Florida Governor's Hurricane Conference back in May, that I think everybody on the call should try and attend next May in West Palm Beach. Shameless plug. But one of the ideas was to have a shelter, like a mock shelter, where the county would open up a disaster shelter, and they would invite people with disabilities, people from the community, disability planners, and they would basically staff the shelter like it would be during a disaster, but there's not a disaster. But it would be a way for them to for everybody to kind of get a feel for, this is what a shelter is like. This is what to expect in a shelter for the people with disabilities, with access and functional needs. And the shelter staff would get a feel for what to expect when working with someone with a disability. Kind of like the disaster drills, but kind of like sometimes you see with disaster drills that the sheriff's department does. that's also a great way to introduce them to the disability community, is include people with disabilities in the disaster drills. A friend of mine who is who runs a Center for Independent Living was telling me that they had a couple of guys in wheelchairs that use wheelchairs, and in their local county's disaster drill, he didn't tell the people doing the disaster drill that there were people with real disabilities, participating, acting out. And it came as a shock to a couple of the law enforcement when they told the guy, "Hey, we're done. You can get up now, Bob." And Bob said, "But I can't. I'm in a wheelchair, a real wheelchair." Yeah. So.
This is Sadie. I love that that example. You're actually it was teaching by example, right? You were teaching others to walk that walk, or that talk by walking that walk. So yay, thank you.
Yeah.
All right, I'm going to move this question over to Yumi.
Great, thank you. I'm just looking at time, 10 minutes. I had a story, but maybe I won't tell it. But I do want to tell the story, so I will. I actually come from the disability rights movement globally. And I just wanted to kind of end my piece of it with, I actually take inspiration from the UN Convention on the Rights of Persons with Disabilities, which aims to dismantle the attitudinal and environmental barriers and respect the dignity of persons with disabilities and support the participation in society. So I just wanted to put that out there sort of as a personal value that I live by. And I know there's a lot of questions, and we can't cover it all in this short time period, but I just wanted to mention also my own journey around disability rights. And it was really in Bangladesh, at the other side of the world, where I interacted with people with disabilities, especially in emergency situations. We were in a coastal village in Bangladesh, and I was actually guided by Vashgar. He's a blind leader and a trusted messenger in the disability movement. And he shared with me how people with mobility and access needs were left behind during the monsoon floods. It was really a tragic story, but it was how he, as a disabled persons organization, DPO, he was telling his stories of how he, as a community member and as a community-based organization, worked with local government to improve the communications for those who were being left behind. This might have been including radio to reach out to blind people, or those who were not literate, or to make shelters and restrooms accessible. And this is a very rural area, very but also a very dense area. And it was also to raise awareness about the rights of people with disabilities, as well as even within their families and communities. And so this was sort of the impact that the movement itself has had on me. And I think that when Vance talked about how perspectives matter, it really touched me, as well as it touched the others around me, right? So I've worked alongside and traveled in the Peruvian Amazon to the UN with friends and colleagues and people with disabilities. And so last month, really, so this all culminated, is that a word, with the for our vaccination campaign last month. What we did was, and really as a government agency, right, and I think Sadie, you talked about the forced multiplier effect, but really to get staff also to understand and to learn. I designed these listening sessions for our staff to get out into the community and hear from the community members themselves. My goal, as I told my staff, was to make my staff cry, so that they can really be emotionally touched in order for them to take action. Because without empathy, you really cannot take action when you're working with community. And also by doing this, we amplify other voices at our table where our decisions are made, and in our office where, smaller decisions are made. I mean, it was as simple as having an ASL interpreter, closed caption interpreter for all of our CBO meetings and community meetings. So it really builds the awareness of needs and priorities of people with disabilities. And I really need to thank also my colleagues, my former colleagues, and also my partners in the disability community for really being patient. Now, sometimes they're not patient, but being patient with me too, and others around us to really keep on this journey of learning.
Sadie, I
That's
call
all.
that seeking to understand. That is, you just demonstrated a whole story about seeking to understand. And with that, I know we're down to the wire here, and Iskra, pardon me, and Don, pardon me. You're welcome to chime in, but I didn't want to leave this panel without calling out the Inclusive EM app. This app was brought out about a year ago, and holy moly, is it a wonderful area to share information. So with that, Dawn, will you give me about a minute or two on talking a little bit more about that Inclusive EM and where people can find it?
Sure. Yeah, it's so it's a platform called the Inclusive Emergency Management Community, IEMC. It can be found at inclusiveem.community. And I launched this mid-fall last year, and we're already over 320 members. It is a free and open community that works to bring together people interested in working in inclusive emergency management all to one place, so that we can access diverse connections, share knowledge, experiences, and ideas that really help us expand the inclusive emergency management movement and work smarter, more efficiently, with less friction in our own roles. So together as a community, we collaborate on challenges that don't have an easy or an obvious answer. We translate what we need to do, be accessible, equitable, equally effective, into how we actually put that into practice. We increase the prevalence of inclusive EM practices, and then we work together on this much larger purpose while finding ways to improve and expand our own work in inclusive EM in our own unique spheres. So if you think about it, if you've got two people in your agency or your organization working on inclusive EM, how much better are 325 brains going to do together than just one or two? In the chat, we've seen a couple of questions about access functional needs positions in the EOC. Right now, there's a working group on this community who is working on job descriptions, SOPs, job aids for AFN EOC positions. So again, it is a free community to join. It's growing. You can do Q&As, polls, share articles, share links, share videos, and just really engage in this conversation and grow your own knowledge, but also share all the great stuff that you have as well. So I think that's going in the chat. Happy to answer any questions folks have, and then connect with you guys there. I know a lot of people who are here today are already on the community, and I thank you guys for that. Thanks, Sadie.
This is Sadie. Thank you. And just to remind you, I'm sure there is so many wonderful questions that have come in. We have not answered them all. However, we are capturing them all, and if you will, we're capturing them there, as well as, please, if we did not answer it, remember to email those, and I'll re-drop into the chat that email address so that we can come back to it. And with that, I want to extend a huge gratitude to Iskra, Yumi, Bryan, and Don for all the whole community inclusion planning work in emergency management that you're doing. I think us coming together are able to share our stories, as well as now people in this webinar also have other partners to now learn the how-tos tied to everything that we must do in order to save people life and property and not leaving people with disabilities or people with access and functional needs behind. And so with that, I am clapping and saying thank you. And I'm going to ask all of our panelists to please turn off their cameras, and we're going to hand this back to Vance.